Good morning. My name's Dottie Weston Murphy, and I welcome you this morning, and I want to thank you for starting your week with us. We are extremely grateful to each of you for all that you do for our community, and so glad that you're here today. Thank you for your support to our local nonprofits. Thank you for your support to the Greater New Haven COVID-19 Community Fund. Today, we will provide you with an update of the many ways we're supporting our local nonprofits, update you on the COVID Fund, and then this briefing will specifically focus on food insecurity, on basic needs. And we are thrilled that Steve Werlin, the Executive Director of the Downtown Even Soup Kitchen, has taken the time to join us this morning. Before I turn the program over to Will, I'd like to go over a few housekeeping items. So all participants except for the panel are muted. If you're having any difficulties, please contact us on the chat line, and you can type in and press enter, and we have staff able to help you. And then we will take questions and answers. You see a Q&A box. It's typically on the lower portion of your screen. And type in the questions, and after the panel speaks, we will take questions from the audience. All right, I will turn the program over to Will. And again, thank you so much for all that you do for our community.
Good morning, everybody, and thank you, Dottie. Thank you, Steve Werlin, for joining us this morning to talk about COVID-19 in the context of food insecurity in our community. I'm going to give some introductory remarks, and then I'm going to turn this over to Christina Ciociola, our Senior Vice President for Grant Making and Strategy, who's going to talk in more detail about the grant making we're doing and have a dialogue with Steve. So let me start with some general comments about COVID-19, what we're seeing in our community, and indeed as we talk to others around the state and around the country. Our work at the foundation has completely changed in the last month or so. When we were last in the office together, our staff, on March 13th, we were doing very different work than we are doing, than we have been doing since. COVID-19 has taken over. We not only work in a different way, but we're doing different work. We hope to go back to our traditional work at some point, as we all do with our lives. COVID-19 has taken over because it is a challenge unlike any other. First of all, it affects everybody, and it affects everything. And you all know that from your own lives. And there's a level of uncertainty that's unlike anything we've seen in the past. So a big part of what we're doing is, as the slide says, listening and learning, reaching out to the nonprofits in our community, talking to donors in our community, talking to elected officials at the city level, talking to our fellow community foundations and other funders around the state, to community foundations with which we have relationships around the country. We are trying to figure this out as we go. And we know that changing every day, don't have a sense of how deep this is going to be or how long this is going to go. We know the impacts are huge right now. Locally, we're working, and I'll say more about this in a moment, as will Christina. We're working closely with United Way of Greater New Haven. They are our partners on our specific COVID-19 fund, which we've created, and I'll say more about that. We are on a weekly call, actually 2 weekly calls with Yale University officials. Yale has established its own COVID-19 relief fund, where it's 2 calls because one of which includes City Hall as well. So we're on a weekly call with city officials about what they're seeing in New Haven. I'm working particularly very closely with others at the state level, at the behest of Governor Lamont. A group of private citizens that I've been part of have created a new foundation called 4CT, 4-CT, to address COVID-19 impacts on a statewide basis. And we're working closely with other community foundations, our affiliate in the Lower Naugatuck Valley, the Valley Community Foundation, and other community foundations around the state to understand this and to respond in the best way we can. From a health perspective, again, you all see the data as we do. The numbers continue to rise. The human toll is enormous and tragic in New Haven County, in the state, around the country, here in New Haven County, and in the city of New Haven. The social and economic impact is profound and deep and tragic as well. Our economy is basically shut down, as you all know. I was looking at some of the economic data this morning. According to the Connecticut Department of Labor, 370,000 unemployment claims have been filed in our state in recent weeks. This is a state of 3.5 million people. That's 1 for every 10 people. So what that is in the labor force, I don't have the specific data about how big the labor force is, but that's really an unthinkable number in a state like ours. Food stamps, the same thing, and this relates to what Steve and Christina are going to be talking about. But food stamp use has spiked to 10 times the normal level. More recently, it's been about 4 times the normal level. So with unemployment running the way it is, we have a really whole new definition of vulnerable in our community, and we are rethinking on an ongoing basis are the vulnerable populations in our community. And yet, tragically, perhaps not surprisingly, but tragically, the definition of vulnerable and the vulnerable populations are tragically familiar at the same time, because the same groups defined by race, defined by geography, defined by ethnicity that have suffered from the inequities of our society forever are suffering from more deeply from COVID-19. Actually, there was data published at the end of last week by Data Haven, which is the organization that the foundation has supported for many years about this. I'm looking at it on my screen right now. It shows in COVID-19, this is as of yesterday, actually, it shows COVID-19 cases per 10,000 population. In the Black community is somewhere between 50 and 55. In the white community, it's about 20. In the Latino community, it's about 40. In COVID-19 related deaths per 10,000, in the Black community, almost 5. In the white community, a little over 3. And the Latino community, less than 2. So COVID-19 is accentuating and deepening the inequities in our society in profound ways. That's happening economically too. The federal response, and we're monitoring this very closely, the small business assistance response has been highly inequitable in terms of the way the money's being distributed, because it's all through the banking system, and so much of the minority-owned business and women-owned business and businesses in low and moderate income neighborhoods are not banked. So there are efforts being made at the federal level to address that in the next phase of COVID-19 relief. So this is the landscape that we're trying to address ourselves to. And we have, so I'm going to go through quickly the ways in which we're doing that as a grant maker before I turn this over to Christina. We've raised significant dollars. As of now, about $2.1 million from donors, as you see, individuals, family foundations, businesses, a terrific response from donors. The Community Foundation has put in about $500,000 of our own money, which is both reallocating funds from our budget and also doing what we call a special appropriation, which is, to put it in endowment terms, to invade of some of our health preference funds. The foundation has the extraordinary power to do that, and our board, and I think several of our board members are on this call, and I want to just give a shout out to them. Kalila Brown-Dean, I know Kalila was on the list. Kalila is our board chair. professor at Quinnipiac University, and is also chairing our COVID-19 committee, and has done a wonderful job as a leader in this. And I think Greg Pepe was coming on as well, who's a member of our board. So, and there may be other board members on as well. I know there's some former board members as well. But so we have reached into some of our health preference funds for beyond the spending rate into the corpus of those funds, and we might consider doing more special appropriations as the weeks and months go forward, depending on what we're seeing out in the community. We are accelerating, in addition to the 2.1 million we've raised, and I'll talk about that in a moment. We're accelerating and repurposing grants that were already in the pipeline at the Community Foundation. So we've accelerated the multi-year grants that would have been paid much later in 2020. These are multi-year grants that were made last year, and in some cases made 2 years ago. That's over $1 million that went out at the end of March that would have gone out 6 or 8 months from. Similarly, we are repurposing and accelerating project grants from prior years. That's another 400,000 or so that would have gone out later in the year. We have about $3 million in designated grants to designated beneficiaries that would have been paid over the course of the year. Those are being accelerated into the second quarter, and about $1 million of that will go out in the next week or so, and then the rest in May and perhaps into June. So that's another $3 million. Our new grant making for 2020, which is a pot of something over $2 million, which would have, in the normal course, traditionally those grants have been made in October. This year we had accelerated them to July, unrelated to COVID-19. Our board is scheduled to meet May 21st to make those grants, so we're accelerating those into May as well, and that's plus or minus around $2 million. So if you take all that together, what I just listed, that's about as much as $6.5 million of the foundation's grant making that is being accelerated and repurposed related to COVID-19, and it'll be out the door, most of it by the end of May, some of it perhaps in June. In addition to that, and in addition to contributions to our COVID-19 fund, our donors have responded with over $500,000 in the last month in donor advised grants related to COVID-19. So that brings that number to about 7 million. And then we have the COVID-19 fund on top of that, as I said. So that's about 2.1 million has gone in. The first round of grants went out 2 weeks ago. That was $600,000. We're in the middle of the second round now. We've already got $400,000 of grants that we've approved, which we'll be announcing later this week. And it'll be higher than that because we're going to make additional grants this week. So we will, by the end of this week, have committed half or probably more than half of our COVID-19 fund. We're doing this in a partnership with United Way of Greater New Haven. We are doing the distribution. We have a wonderful committee of six community leaders as volunteers, 3 from the United Way side and 3 from the Community Foundation side, and staff of United Way and the Community Foundation, led by Christina and Jennifer Heath, and Sarah Fabish and Ali Fox from our two organizations have been on the phone with dozens and dozens and dozens of nonprofits to understand, with a focus initially on the front lines of this fight. So what does that mean? It means basic needs, food, shelter. We're going to talk about food in a moment, and it means healthcare. So the first 2 rounds are focusing on those things, but we're also thinking about how can we address the kind of racial and ethnic and neighborhood disparities that are so evident in this COVID-19 situation, and what about other areas that we haven't reached yet? Education, youth services, the arts, the inequities in education I didn't mention are heartbreaking. That there are so many children at home in New Haven whose families don't have the technology equipment to do remote learning. So the needs are enormous, and as we are focusing our COVID-19 fund now, as I said, on these frontline services, and we are talking about how that needs to continue to evolve as we go forward. So with that, I think I will turn this back to you, Dottie, or to Christina. Where do I turn this? To Christina.
Christina, you want to take
There's
it from
Christina.
here?
So Christina's going to talk in more detail about the grant making we're doing and how we're doing it, and then talk specifically about the food issues, Steve Werlin. So thank you.
Thanks, Will. And I want to add my thanks to the folks on the line for your generosity, your interest, and for sharing information with us about the things that you care about and the challenges that you're seeing out in the community. As Will said, we are listening and learning, and we're gathering intel from everywhere about the challenges, not just directly from the nonprofits, but from our networks in the community as well. So I'm going to tell you a little bit about what we are hearing around the challenges and the community needs, and then I'm going to tell you a little bit about our COVID-19 Community Fund grant making. I do see in the chat box someone has asked a question about grant making, so I'll answer that question when we get to the COVID-19 Community Fund grant making, and if I forget, Dottie will remind me. So if you can move to the next slide, Carmen, thanks. So some of what we are learning and hearing from the nonprofits in the region is that there's an overwhelming revenue loss from closures, canceled events, and the transition to telemedicine. And this is across the entire sector. The arts community has been devastated by having to essentially shut down their performances and events. Nonprofits have had to cancel their fundraising events, which usually happen in the spring through the fall. And many healthcare providers, as they've transitioned to telemedicine services, they're seeing about 60% of folks are not taking advantage of those services or signing up for appointments. That is not only concerning for the welfare of the well-being of the patients and clients, but it also has a significant impact on revenue. Many of the healthcare organizations are projecting six-figure losses in revenue as a result over the next few months. We're seeing an increased demand, particularly for basic needs. And I think there's anecdotal projections that the next 10 to 12 weeks that this is just going to keep going up, particularly around food. So I look forward to hearing from Steve about this. And also, as Will mentioned, the racial and ethnic disparities, the already existing inequities are just being exacerbated by this crisis. And that's in health, financial empowerment and well-being, financial sustainability, and in education especially. We're seeing challenges of delivering essential services while adhering to social distance guidelines, particularly in healthcare, mental health, and case management services. Organizations are challenged in being able to check in on the well-being of their clients and to ensure that some folks are really adhering to social distance guidelines. They may have mental health issues or other healthcare issues that may prevent them or put them at greater risk for not adhering to social distance guidelines. So we're seeing organizations do some creative things to change how they work to check in on their clients. As Will mentioned, the education and distance learning challenges are overwhelming. Families do not have the technology they need to implement distance learning, and there's also families are at home, parents are working at home and also having to manage the education of their children simultaneously, and that's a challenge. And also many children are being left home alone because their parents are essential workers and continuing to have to work outside the home when there is no daycare or school opened. We're also seeing significant staffing and just organizational challenges for the nonprofits. There's been layoffs, there's unemployment, there's the lack of availability of volunteers because of social distancing and at-risk groups who are usually the ones that volunteer, particularly older individuals. There is a need for hazard and overtime pay for organizations that have kicked into high gear, particularly around basic needs. And then there's sick leave and the emergency leave, which is also impacting the staffing and availability of nonprofits to provide essential services. There's also a huge impact on small business, especially in New Haven, a city of many small businesses. And there are two efforts that I know of, and maybe Steve, I'm sure he knows of these efforts, he might be able to talk more about these. but there's New Haven Strong and Keep New Haven Thriving. New Haven Strong is an effort organizing restaurants to help provide meals for the homeless individuals who've been moved into hotels. And Keep New Haven Thriving is another effort organizing restaurants to provide meals to frontline workers and healthcare workers. So those are a couple of small business things going on, and we're learning more about those efforts as we move forward. So I'm going to talk a little bit now about our COVID-19 grant making process. As Will said, we're working in close collaboration with the United Way. The initial purpose of the grants are to support organizations working on the front lines with individuals most severely and disproportionately impacted. Those are homeless individuals, undocumented immigrants, the African American community, healthcare workers, seniors, particularly those who are homebound, and people with underlying health conditions, and people who are economically disadvantaged. I think the economically disadvantaged category is growing as more people become unemployed and find themselves in difficult financial positions. Our process for grant making from the COVID-19 fund has been proactive and a rolling process. We're awarding grants approximately every 2 weeks or so. And we are trying to make that process as least burdensome as possible for the nonprofits. So we initially have been proactively reaching out through our networks to the organizations that we know well and that we know are on the front lines. If you look at this pie chart, it's a breakdown of how these grants have been distributed so far. You can see nearly 40% have gone to issues around food insecurity, and 33% to health, 14% housing, and 15% to social services. Now, although the fund is focused this way right now, it does have the ability to pivot to other needs as we anticipate the needs will change and shift as this crisis evolves. So we will continue to monitor that and shift the purpose of the fund as time goes on. So there was a question about the grant making in the chat box, which I'll answer now. And it was a question about the, if all of our grant making is focused on COVID-19, what about the organizations that are not focused on COVID-19? So I would say there is a distinction. There's the COVID-19 Community Fund, which is focused as I just described. And then our broader responsive grant making, actually, the applications that we have in right now were submitted in February. So that was pre-COVID-19 crisis. And as usual, we cast a wide net across a variety of issue areas for that grant making. We are seeing that most of the applications we receive, those organizations have been impacted by COVID-19. They don't have to be providing basic needs. It's our ability to respond more broadly to the impact of COVID-19 and provide general operating support to organizations that have been impacted by this crisis, not only those providing basic needs and health services. And I see another question here in the chat box for, oh, that was it.
Christina, there's a question. It's what's the best way to buy a computer for homebound students? And I can answer that, and then you could add to that. Actually, we have a fiduciary fund set up for New Haven school students based on the interest of an individual who grew up in our 20-town region and now lives in Fairfield County, and reached out to our to Mayor Elliker wanting to help New Haven school students. And so we served as a fiduciary, and there was a major gift that was made into that fund. And then we were able to get computers to the students. So that is one way. Do you want to add anything to that, Christina?
I would just add that I know the public school system, the superintendent has said that that is the role philanthropy could play to help students, is to help them provide Chromebooks for the students. It's not easy to get Chromebooks, but I believe we are working with the school district and they have a way to support that. And I think the Yale Fund and others are going to be supporting that as well. There is a shortage of 10,000 computers, they estimate, which is $2 million cost for Chromebooks. And some of the younger children need iPads to help facilitate their learning. So
the Chromebooks are about $240 per book.
Yep. Thanks, Dottie. So as you could see, the food takes up almost 40% of our grant making from the COVID fund. And I want to transition now to Steve Werlin, who is the Executive Director of Downtown Evening Soup Kitchen. And he is co-chair of the Coordinated Food Access Network. I think that's what it's called, CFAN. And he could tell us more about that. So thank you, Steve. Welcome. And thank you for joining. I have a few questions here to get us started, and then we hope we'll get some questions from the audience as well. So on a normal day, food insecurity is an issue in the region. And these have not been normal days. As we know, COVID-19 has exacerbated the needs around food insecurity in Greater New Haven. If you could talk about what has changed for the populations that were already experiencing food insecurity, as well as the newly emerging populations who are now finding themselves needing assistance.
Thanks. Yes, there's really a couple of different pieces to that, right? There are those who were already in the system and those who are coming into the system now. So those who are already in the system, the biggest change has been for those who are 6 years or older or otherwise immunocompromised, who are now being told that they shouldn't be leaving their homes. Immunocompromised is, covers a pretty big category. If you look at the list that the health department for the city put out, it's very long, and that includes most of the people we're serving. And so we have been moving pretty quickly to try to figure out how to get food to those who are experiencing food insecurity, but unable to get to the pantries that they're used to coming to. And then the other of that, of course, is that we have people who are used to accessing a pantry, but also supplementing with income that they're getting from, for example, SSI, SSDI, Social Security, maybe food that they're accessing through the SNAP program. And for that, of course, they would have to go to the grocery store. So they have assistance, but are now no longer able to use that assistance without going to the store if they're being told that they're home. So then the other piece of this, of course, are those who are now coming into the system for the first time. Over the past few weeks, anecdotally, I can tell you that we've been seeing a rise in the number of new people coming. Our numbers have been dramatically increasing as we've been transitioning a lot of the folks who have been coming to our pantry over to this new delivery program, which I can speak more about in a moment. We've found our numbers continue to go up. In other words, we're having new people coming into the system for the first time. And so we have this whole big group of people across Greater New Haven that are now having to figure out how to navigate the system, find their ways to pantries, and then of course get food from the pantries, which are seeing a much higher.
Thanks, Steve. So through our COVID grant making, we've seen how the network of providers have shifted how they do business to accommodate the crisis. We've seen innovative ideas and a significant amount of collaboration. Can you talk about how your organization and other soup kitchens, pantries, and restaurants are coming together to address the need, and how you've kind of all changed the way you do business?
Absolutely. So in normal times, the food that we are distributing through our food pantry, as well as in-house for our soup kitchen, our evening meals program, about 6% of that food from the Connecticut Food Bank, another 20 to 30%, depending on what's going on, coming from local retailers, and then 10 to 15% of our food is coming from food drives that are run by faith-based organizations, schools, businesses. So that last group, that group that's doing the food drives, that's out right off the bat because none of those are meeting. No businesses, no faith-based organizations, no schools. And then on the side of the retailers, Stop and Shop, Big Y, Target, also wholesaler, and the Connecticut Food Bank, a lot of those lines of supplies have been disrupted because of the increase in demand that we've all been seeing at the supermarkets. So we've had to adjust how we get food. Now, all of this isn't to say that the food isn't there. The supply lines are still there, but they've just been moving around in different ways. So we've found ourselves having to really work hard with some of the partners that we've had for a long time, with Yale Hospitality especially, but also some of the larger wholesalers like Carbonello and DeSarbo, who was in the news recently for some of the good work they've been doing, in order to get more food in so that we can then distribute it. The picture actually on the slide here on the right is actually from meals that were produced by Yale Dining, Yale Hospitality, and then brought over to us. So we've been really benefiting from some of the work that they've been doing in order to get food out in this form, what we call MREs, meals ready to eat, basically to-go meals, so that we don't have people congregating around. And the photo on the left, that was actually taken just before we started serving dinner one night. Of course, we've transitioned everything to outside because we can't have people congregating as part of our dinner program anymore. And so now we've, at the beginning, we were still serving hot meals. Now we're trying to serve fewer and fewer hot meals. We're trying to stick to really cold meals so that it can be easier on the volunteers and staff that are preparing it, and then easier to eat so that it can be kind of moved very quickly to kind of keep people moving and not have people sitting down and congregating as we're being told not to do.
Can you talk a little bit about the Coordinated Access Food Network?
Yeah, so it's called CFAN, or it's actually Coordinated Food Assistance Network. This is a collaboration that started about 10 months ago as part of a 5-year grant that the Community Alliance for Research and Engagement had gotten. They included in that working with food assistance organizations to form sort of collaborative network. And this is something that has been tried in the past and has had various levels of success. We're trying to reignite this last fall, or actually spring and then into the summer, and then it really got going in the fall. Because we were actually in a really good position when this crisis hit to suddenly come together and start working more as a network and as a collaborative. So this includes most of the larger food pantries in town, like Downtown Evening Soup Kitchen, Loaves and Fishes, Jewish Family Service, Fish of Greater New Haven, most of the larger ones, as well as some of the smaller ones that are operating out of police substations. There's a group called Women of the Village up in Dixwell. There's a group called NICE out in the Hill. Fairhaven works with Vertical Church, which operates a food pantry out of their station. And then it also includes kitchens, the 3 big ones being Sunrise Cafe, Kitchen on Broadway, Evening Soup Kitchen. And so this collaborative network has really been, as I said, it sort of existed before, but when the crisis hit, we found ourselves really needed to rely on each other to figure out, well, how are we going to get food to this increasing number of people in ways that, really we haven't had to do in the past, specifically through a delivery program. So within the first week, we really identified the need to be doing this delivery program. We scrambled to come up with a program model for it. We found a staff member actually to oversee it, and it's been really ramping up over the last. And I should mention also that a big piece of this has been support that we've gotten from Yale and from the United Way and from the Community Foundation to make it happen. I mean, this has really been a big to this as well.
Hi. Oh, we have in the chat box, Steve, someone is saying hi. They're one of the CFAN volunteers, and they just started making reminder delivery calls last week to Spanish speakers, and they're thanking you for your initiative.
Yeah, no, it's been a remarkable. It's remarkable to see how quickly a program can get up and running when you're really finding yourselves in a crisis. I mean, the need was there, and we just had a really good group of people around the table, a virtual table, and we were able to make it happen. But none of it would be able to happen without this large core of emergency volunteers that have really come out of the woodwork and really been helping us out. I should mention that's been one of the big changes as well. all of these organizations rely quite on volunteers. And I think, as Dottie or Christina mentioned at the beginning, that many of the volunteers we usually have are themselves over 60, or again, coming through faith-based organizations, businesses, schools. And a lot of our typical volunteers have really fallen off. But what we've seen is new people stepping into this role. So it's been great to actually see people coming up and forward to volunteer.
That's great to hear. Thank you. We've seen and Will mentioned earlier, the recent data in Connecticut and also around the country about the disparate impact of COVID-19 on the African American community and the Latino community. I'm wondering if you could say a little bit about what you're seeing around those inequities being exacerbated, particularly around food insecurity.
Yeah, no, I mean, it's the Black and brown communities have always been disproportionately represented among those we serve. That's always been the case. And we're not seeing too big of a change on that front, because it's always been the way it is for food insecurity, unfortunately. What we have noticed also is a specific uptick in Spanish-speaking clients who are coming to our pantry service in particular. I hesitate to speculate much. We don't ask questions about, certainly we don't ask questions about immigrant status or anything like that when people come to us. So I can only sort of speak anecdotally, but we noticed an increase in those who are speaking Spanish. A lot of people who are new to the system, who have never had to access food assistance. If I can sort of speculate a little bit, I do wonder how many of those people are coming to the system new because their immigration status doesn't afford them the ability to access the stimulus money that many people have been able to access, or doesn't afford them the same protections, labor protections that a lot of people are getting. They don't have jobs where they're getting or have you. I think we have a very tangled web there, but it is very concerning to be sure.
I'm wondering if you could say a little bit more about at least two of the access issues that we've been learning about and how those are being addressed. One is, which I was surprised to learn, that the SNAP and EBT cards cannot be used for online grocery shopping. And as you said before, those people have benefits, but they cannot now use those benefits, especially if they're homebound or if they're quarantined because they're a high-risk group of people. And the other barrier is around transportation. I know some of the pantries have set up grab and go model to get food out to folks. So there's no congregate meeting and dining together. But if you don't have a car or transportation, you can't get to the grab and go to get the meals. And I'm wondering if you could say a little bit about those two barriers.
Yeah, so the SNAP and EBT access, it's really a policy issue, and DESC as a frontline service organization is happy to advocate around this, and we do. But we really need to turn to elected officials and policymakers to see about what they can do to make that happen. And there's a whole other range of issues surrounding access to food in grocery stores that also needs to be addressed. And I know that is something that the city is working on and working with the Perch Research Group as well. So hopefully we will see something move on that. I will say also that these sorts of things tend to be, of course, slower to react than sort of on the ground frontline services. In terms of the access issue for transportation, part of the reason that we were really quick to get this delivery program off the ground was because we knew that there were going to be people who suddenly have access issues that didn't exist before. But on top of that, CFAN has been really important in bringing in some of these smaller pantries. When this all first started, the larger pantries like DESC and Loaves and Fishes and JFS and Wheat out in West Haven, we were all quick to respond because we're larger, we're well organized, we have more staff, we have more resources, we have a larger community. But we knew right from the beginning that the smaller pantries operating in the neighborhoods, these real neighborhood-centric pantries, are going to be key to ensuring that people in those neighborhoods are still able to access food by foot. Because you're right, because a lot of the people who are typically crossing town either by bus or what have you, wouldn't be able to get to those places. So, so part of our strategy has been to work with some of these more neighborhood-centric pantries to get them up to capacity as well. I think we've got you muted.
Yep, thanks. Before we get to some of the questions from folks on the line, I'm wondering if you could tell us a little bit about what you anticipate are going to be the greatest challenges in the coming weeks.
Yeah, that's a good question. You know, I think we're going to continue to see more of the same. You know, we've seen sort of our numbers doubling every week, and I think we're going to continue to see our numbers double for the next 10 to 12 weeks at least. Beyond that, it'll depend largely on the economy. It'll depend what's going to happen. I'm not an economist, and I don't have a crystal ball, so I don't know any better than you do as to whether or not 6 months from now people are going to be back working, and the social safety net programs that we have are going to be able to fill in the gaps, let alone 12 months from now or 24 months from now. You know, I think the assumption that we're all working on right now is that things won't be going back to how they were anytime quickly. You know, before all of this, I mean, as some people know, you know, Desk was looking, for example, at, you know, moving locations. We had, you know, this great, you know, 3-year strategic plan that, you know, was really going to launch us into new program areas, and we were very excited. And now all of that's on hold, really, because we are facing a need that just didn't exist 2 months ago. And I think that that's going to change a lot of things for a lot of the frontline organizations. We're going to find ourselves really going back to basics in a lot of ways. And it's going to require more food. It's going to require more people in terms of both volunteers, but also staff as well. You know, to keep up with the demands in recent weeks, we've had to increase our staff numbers. I'm hiring 2 new people this week to get more food moving. I hired someone last week. So, and these are temp workers, but I have a feeling that that 10 weeks from now, 12 weeks from now, we're going to continue to need them actually.
Okay, so now I'm going to take some questions that are coming in from folks on the line. One question is, what is the present increase in need for food versus shelter? I don't know, Steve, if you could address that question related to shelter.
Yeah, it's a good question. You know, it's 2 separate but overlapping populations that we see here. Certainly those who are in need of shelter are in need of food. Usually, you know, when we talk about people who are unsheltered on the street, you know, it's a different kind of food. So those folks are accessing most of their daily calories from the soup kitchens. And you know, we've had a bit of a problem there, of course, because we are offering less calories, less food than we usually do. I mean, we're all doing this sort of grab and go. We try to put more in the bag, but certainly people aren't getting as many calories as they do when they come into our space. They sit down, they eat a meal slowly, maybe they come up for seconds. You know, that it's kind of a whole different ballgame in that sense. You know, the shelter situation, Desk has been part of the discussion, you know, since the beginning. You know, of course, we are not a homeless service provider in the sense that we don't offer shelter. But of course, we serve the homeless population and in many ways function as an outreach center, at least a forum for people who are experiencing homelessness. So we have felt that it's important to be part of that conversation. If I can just give a quick, brief overview as to what is happening with the homeless population right now. Statewide, the strategy was first and foremost to focus on what they call shelter decompression. That is, moving all of those folks who were in shelters already out of the shelters and into hotel rooms. And the thinking behind this was that, that with so many people in a shelter, it increased the likelihood for potential outbreak within the shelters. And that is something that has happened in other states that we've been seeing over recent weeks. And so they moved very quickly, rightly, to decompress the shelters, and all of the folks who have been staying in the large shelters in New Haven have all been moved out of those shelters and are now in individual hotel rooms, which is wonderful. The next question becomes, well, what happens to those who are unsheltered and on the street? There is an argument that in some ways they are safer on the street, certainly than they would be in shelters right now. But I think we have to remember that being unsheltered and experiencing literal homelessness of itself a health emergency, always has been. And it's just exacerbated by the current pandemic. So we've been working with the homeless services providers to try to get those folks also into shelter, into the hotel rooms. The money is there. We're running into problems in terms of staffing and in terms of some of the logistics to get those folks into shelter, but the wheels are moving. And I know that the city has been a big proponent of working with the homelessness service providers from the beginning in order to get people into the hotel rooms. So hopefully in the coming week or so, we'll start seeing more and more people moving into hotel rooms, which will be wonderful.
Thank you, Steve. And we've also heard from some of the shelter providers and our grantees that now that decompression has been somewhat successful, there is concern about the people becoming newly homeless and what to do with those folks as they come into the shelter and the increase in demand, ongoing increase in demand on that end. We have a couple of more questions. One is, as you deliver food, are you finding that folks are suffering mental health challenges due to isolation? And if so, are you able to address it, acting as a conduit of sorts to organizations that could help them?
Yeah, I mean, I don't have figures on this, but anecdotally, yes, we do know, we have gotten reports from some of the volunteers saying that, the protocols and instructions for those doing the deliveries are that they're not supposed to be interacting with those they're delivering food to. They're supposed, everyone is masked, everyone is wearing gloves, and they're really supposed to give them a call from their car, say, your groceries are here, and then leave them outside their door to minimize the interaction. But inevitably, people are lonely. People are in their homes, and it can be, it's a new, as everyone says, it's a new reality, right? It's a new way of living for a lot of the people who are used to coming out to pantries. In the first few weeks when we started doing outreach around this new delivery program, we got so many responses from people saying, no, I don't want to sign up for delivery. I love coming down to the pantry. This is my time during the week to get out. I'm thinking especially of people who are over 60, who aren't working and are used to using these pantries almost as part of their social network. I mean, they see a lot of familiar faces. They interact with our staff and volunteers. And so I think it has been difficult for those folks who are used to doing that to suddenly have that taken away from them. So I do think that we're going to find, as we move forward, that there will be a whole range of mental health issues that are going to have to be addressed.
Sure. And we've heard many of the social service and healthcare providers are finding ways to check in on their clients. And one of those ways is that they're delivering groceries while staying socially distant, as just a way to first remind some of these folks who are out living in residential care settings that they need to stay, adhere to the social distance guidelines, and as a way to just check up on their well-being and to especially check up on children. One of the issues that has emerged is that all of these children now are out of the school district, out of sight of teachers and other kinds of mandated reporting. And we know that all of the reporting of abuse and neglect has been down. And there's concern about what's happening out there with some of these children. Yeah. And using these ways, whether it's food delivery or other types of mechanisms to check in on these families.
Yeah. I mean, it isn't anything we've been doing deliberately, but I can say again, anecdotally, it is happening.
Right. Can you say, I don't know the answer to this question, maybe you do, whether the New Haven Public Schools will continue to provide meals during the summer, and if not, how can CFAN help address that need?
Yeah, so that's a good question. So when this all started, of course, we had a structure in place already to be delivering food to school-age children, and that was the Summer Meals Program. This is something that the New Haven Public Schools and the City of New Haven and various food assistance providers had been doing for years. And so that, the vehicles were there and the training and the staff were there. It was just a matter of repurposing that money. And so the federal government gave the green light pretty early on for school districts to be able to repurpose the money for the summer programs to address the immediate need, if that's what they wanted to do. And so we were fortunate in New Haven. The New Haven Public Schools was, stepped up very early on and said, yes, we will do this. And they started by doing meals, I think 5 days a week. I think now they've cut back to 3 or 4 days a week, but they're still providing the same quantity of food. But I don't know what's going to happen over the summer. If that money has been repurposed, I don't know if they'll be able to continue funding that through the summer. I would think yes. I would say that is going to happen, but I don't know if that's something that's been worked out yet.
Thank you. Here's another question. How do people connect with the delivery food programs?
So there is a hotline, and I can actually put that in here. Pull that up. But there's actually, we just launched a website as well. And
I know we have some resources later on in the slide.
Yeah, maybe we can send those resources out
Right.
afterwards. But I mean, if people go onto the Downtown Evening Soup Kitchen website, it's deskct.org. Right on the homepage there, we've put some information for how to sign up for the delivery program. There's a hotline that you can call. You leave your name and address, and then someone calls you back to do the full intake.
Great, thank you. There's another question here about, looks like this is about the grants. Can you distinguish grants to New Haven area versus greater New Haven area? Any information we shared is about, and our focus of the COVID fund and all our grant making is on the greater New Haven region. I haven't looked specifically, but I could say with certainty that most of our grant making is probably more urban, has been more urban focused on the cities, but again, addressing organizations across the greater New Haven area. I don't know, Steve, if you want to say a little bit about how CFAN, does it work across the region or is it more urban focused?
So, I mean, it's more urban focused, but we don't draw hard lines at the borders of New Haven. We've been working with Hamden, especially with the Keith Center there, and with West Haven as well. So there are no firm boundaries. We call ourselves Greater New Haven as a area.
Okay, so Steve, if people want to help, what is the best way for them to help? I mean, we've had calls from folks who want to donate food, but they don't know where they should donate food to, or is it better to just donate money that helps purchase the food? There's still a demand for volunteers, as I understand it. So what is your advice on what people can do?
So it's a good question. I mean, I say year round that it's always better to donate money than food because our money goes a lot farther in terms of what we can purchase. We have, as an organization, we purchase wholesale, we purchase from the food bank, and these are just lines of food supply that are not open to individual consumers. So we don't pay retail prices for food. So that's always the case, but it's really all the more the case right now. And that's because we are finding ourselves having to purchase food in quantities that we've never had to do before. And also, it's the same case for the volunteers versus staff. I mean, what I love about grassroots organizations is that we are so heavy on volunteer involvement. Over the course of the year, Desk has over 2,000 people who come through our doors to volunteer, and we see that as part of our way to do outreach and to get more people on board with what we're doing, especially when we get people from outside New Haven who aren't local. Now, having said that, right now there are a lot of people who would volunteer who can't. So our numbers in terms of volunteers are generally down. But also we're doing a lot more than we usually do. And so the need and the need for our increased capacity has increased. So we need to rely on consistency of personnel as well, which is difficult to do with volunteers. So to have the spare funds to be able to hire additional staff right now has been proven to be very important.
Thank you. And I see in the chat box someone from our staff wrote in who is a volunteer making some of those delivery calls, said that some of the people that she's calling have wanted to chat for a bit because they were so thankful for the service and probably feeling so isolated and just happy to talk with someone.
Right.
That's absolutely right. That's absolutely right. And I mean, the model for this program was really based on what Fish of Greater New Haven has been doing for years. And when I first moved to New Haven, I used to make the calls and do deliveries for Fish of Greater New Haven. This was back when they were fairly small. They were only doing about 300 or 400 families over the course of the month. And I always used to find that when I made the calls, people wanted to chit chat. And when I would go do deliveries, I mean, this was before COVID-19, so I would go into buses and drop it off. And most of them were seniors, most of them don't see people. And we would chit chat with recipients for a little bit, and we'd see the same people every month. We'd have our people, and that really is important. The human contact. And so as I said, I think that's going to be one of the gravest fallouts of summer.
Thanks. Will, did you have any questions that you wanted to add to the conversation?
No, nothing from my perspective. I think this has been terrific, and I'm grateful, Steve, for all you're doing and for sharing your on the knowledge with everyone who's on this call today. I think what we're seeing is a level of need, a level of response, a level of cooperation that we haven't seen before, and it is both daunting and inspiring. And the level of uncertainty, as I said at the outset, about what it will all mean as we go forward.
Thank you. Thank you again, Steve. I'm going to pass it back to Dottie now, who's the driver of this webinar.
Oh, I just muted myself. Thank you, Christina. And thank you, Steve, so much for joining us today. We have a page up here that we wanted to show you, and Steve let me know if there are other resources that we can add after this call, but these are different areas that will allow you to volunteer, allow you to donate, and also you said you'd prefer donations, but also food, donate food. So I know there are many organizations that are in need for that. All right, there was just a question whether this presentation will be available online, the one that we're doing today, and we definitely will. So we have a polling question to end our time together. While Carmen is getting up that polling question, I'd like to give a shout out and thanks to the behind the scenes staff people that have been working on this presentation. This is a new way of us delivering information and seeing you and being with you. Carmen Burgos, Linda Stasian, and Matt Higby have all been part of developing this presentation. So we wanted to end with a polling question. How are you supporting our community during COVID-19 pandemic? Please select all that apply. And then, so checking in with family and friends, supporting local restaurants and businesses, wearing a mask when in public, volunteering your time, donating food to a pantry, giving to the Greater New Haven COVID-19 Community Fund, giving to the Great Give 2020, which I will talk about at the very end of the call, and then giving directly to local nonprofits or other. So please check all that apply, and then we will have a tally. All right. Wow. So it looks like virtually all of us are checking in, family and friends, and virtually all of us are now wearing a mask in public. And the group of people on this call today are an engaged group of people that we wouldn't have this wonderful community that we do without you. So supporting local restaurants, some volunteering. I know there's a limitation, as Steve and Christina talked about, if you're on the older side. There's a limitation of volunteering your time. Thank you all for the majority of you have given to the COVID fund. And we haven't officially launched the official dates of the Great Give 2020, but we are open for early giving. So 50% of you are doing that. And then more than 60% are giving to local nonprofits. So thank you so much for all that you do. All right, we're just about at the end of our time. Like I mentioned, the Great Give. So our 36-hour online giving event is May 5th to 6th. We had conversations in these times whether still to do it. And as someone said on the chat box, a broad-based grant maker. And so nonprofits, there are hundreds of nonprofits involved in the Great Give, both those that are basic needs and are directly connected to the COVID fund, but also the arts, education, the environment, advocacy. So our new slogan for the Great Give is coming together while we're apart, and we're rallying to support our community. Thank you so much for joining us today. Immediately after this presentation, you're going to get an evaluation, and your comments are welcome. And like I said, technology, this is a new technology for us, so hopefully, and we're all in different locations. I apologize if there was some times where it was difficult to hear. If there's something that you want repeated, we're going to have this recorded. We had it recorded, and we will be sending out an email after with the overview of this presentation and the recording. Any closing words, Will?
No, other than to say thank you and to underscore the depth of need and the Great Give as a way to respond to that need. Expect that most of the people on this call have been givers through the Great Give over the years. There are, as Dottie was referring to, I think almost 400 nonprofits that will be on the Great Give. This is our community needs to step forward, and I hope that everybody and appreciate all you're doing and appreciate your commitment to our community and to the Community Foundation. There's a message here in the chat from Kalila Brown-Dean, our board chair. Thank you, everyone. Commitment to this community. Stay healthy and be well. I couldn't say it better than that. Thank you. Thank you all.
Thank you. Bye-bye.
Bye.
Bye. Thank you.